Bonjour à tous et bienvenue.
Hello, everyone, and welcome.
Alors, nous allons commencer en attendant que
So,
d'autres nous
we will
rejoignent. Bonjour à
get
tous et
started while waiting
bienvenue
for everyone to
à
join
ce
us.
webinaire
Welcome to
sur
all of you.
l'importance
Welcome to
des
this
actions de recherche
webinar
pour
on the
l'amélioration
importance of
des
using
résultats de
research to
planification
improve
familiale dans la
family
région du
planning
partenariat de
results in
Ouagadougou.
the Ouagadougou Partnership
Je m'appelle
region.
Aïssatou Toye et je suis la
My name is
responsable
Aissatou Toye,
régionale
and I am
de la
the
gestion des
uh,
connaissances pour
Regional Knowledge
le
Management
cadre
Officer for
du
West
projet Knowledge
Africa
Success et il me
for the
plaît
Knowledge Success
déterminer
Project.
le coût d'envoi
I'm
de
excited
ce
to kick
webinaire.
off this webinar.
Donc, n'hésitez pas, s'il vous plaît, à
So
vous
please
présenter
feel free
dans
to
la boîte
introduce yourself
dialogue
in the
en
chat.
indiquant votre nom
You
et votre
can
pays
write your
d'origine.
name and your country of origin in the chat.
Slide.
Next slide.
Alors, veuillez également
So please also
savoir que ce webinaire sera
make sure
disponible en
that
anglais et en français. Donc, si
this
vous voulez
webinar is
bien
available in
faire le
both
choix,
English or
comme en
French,
cas
so you
de
must
forte
choose a
décalage de
language.
votre
First, you'll
connectivité.
click
Là,
at the bottom of your
vous
Zoom
êtes
window on
disponible
the
au
globe
moment de
icon,
la capture d'écran
as
que
you can
vous
see
avez
here
devant
in the
vous et
screenshot.
vous accéderez à la
And
chaîne
then you will be
anglais
able to
ou
choose
française
the English or the
selon votre
French channel.
préférence. Vous pouvez alors couper
You
sur le son
can mute
original
the
si vous le
original
souhaitez
sound if you would like
tout le
to.
monde doit sélectionner une
Everyone
langue
needs
pour
to
s'assurer
select a
que vous
language to
pouvez
ensure that
écouter
you can
nos
hear
orateurs
all of our
car
speakers,
certains
as
membres
some
se
will
présenteront. Bon, ils
present
sont tous
in
francophones, donc il n'y a pas de souci,
French.
mais j'en suis sûre
Actually, I
qu'il y
think
a
all of
des
them will be
anglophones qui vont
speaking in
également nous
French,
rejoindre dans ce webinaire.
but there are some English speakers who will
Vous
also
pouvez
be
également
participating in this
choisir de
webinar.
lire ou non
You can
le
also
cours en
choose
langue
whether or
française.
not to
Vous devriez
use
voir que les
subtitles
documents
or closed
s'affichent. Si ce
captioning
n'est pas le
during the
cas,
session.
vous pouvez les sélectionner en
You
cliquant
should see them
sur le code
automatically, but if
affiché.
not, you can turn them
Si
on
vous
by clicking
souhaitez
on the icon with
modifier
the
ce
two
titre
C's.
plus
If you
tard,
wish to hide
simplement
the
ajustez
subtitles later
le
on,
code et
you can click
choisissez
on the same icon
Hide
once again and
Subtitle
you
dans
choose
une
Hide
autre fenêtre.
Subtitles from the menu that appears.
Si tout titre sont générés
This closed captioning is an automatic
et
Zoom
que ne doivent pas
function,
être
and they may
à
not be
100%,
100%
ce
accurate.
ne sera peut-être pas forcément ce que vous souhaiteriez,
So it might not
mais
be
c'est à vous de voir.
exactly clear, but we will see how it goes.
Alors, j'ai maintenant le plaisir de vous
So now I
présenter le
have the pleasure
modérateur
to
du
introduce
webinaire,
the moderator of
Dr
today's
Mohamed Sangaré.
session,
Mohamed
Dr.
Sangaré est
Mohamed
infirmier en
Sangare.
santé publique à
He is
l'Université
a public
Panelist.
health
Il
physician
possède
with
une formation
several
spécialisée en
specialties. He
comportement,
specializes
en
in social and
développement
behavioral change,
bactériovirale, la
medical
statistique, en
informatics and
data
digital
science,
health,
santé
health
et
information
management de
systems,
projets, programmes
and the
et
management
politiques de
of
développement.
development projects,
Dr
programs, and
Sangaré a été
policies.
chef d'équipe de
Dr.
plusieurs projets
Sangari has been the
éducatifs
team lead
visant à
of
améliorer la
several
vie
communication and digital
des
health
citoyens et
projects
l'innovation sociale
with
au
a
niveau
focus on social
local.
innovations
Il est
at the
également présent
community
il
level.
est le conseiller
Currently,
régional
Dr. Mohammed is
CEC
the
pour les pays
regional
francophones d'Afrique
SBC
centrale
advisor for
et
Francophone
il
West
développe
African countries
des programmes
for
de
breakthrough
communication
action at
sociale et
the
d'anthropologie.
Center for
Alors,
Communication
nous
Programs
avons
of
aujourd'hui
Johns
la chance
Hopkins
de
University.
pouvoir modérer
So
cette
we are so
soirée en
lucky to have
invité de
him with
notre
us today to
modérateur sur
moderate
ce
the
sujet
webinar on
important.
this important
Dr
subject.
Sangaré, à vous
Over to
et bon
you,
webinaire à
Dr.
tous.
Sangare, and
Merci.
I hope you all have a wonderful
Merci
webinar.
beaucoup, Aïssatou, pour
Thank
ces
you
mots
very much,
et
Aisatu. Thank you for
bienvenue
these kind words.
à nos valeureux participants
Welcome to all of our
et bienvenue
participants,
également
and welcome
à nos
as
panélistes.
well to our panelists and
Je
speakers.
vais donc juste donner quelques mots pour
So
ensuite
I'd like to start
devoir
with
lancer
a few opening
ce
remarks
webinaire.
to get the
Et c'est
webinar
vraiment un
started.
réel plaisir
It
pour
is
moi de
truly a
participer
pleasure
à
for
ce
me to be
webinaire en
here
tant
participating in this webinar with
que
you.
co-modérateur
It's a
dont le
pleasure to
thème
be the moderator.
a une grande résonance
The
pour
theme
les
of
différents
this
programmes, les
webinar
différents
has a lot of
programmes
impact
que nous allons
on program management, on policy management,
au cours de ce
and
webinaire.
on the
Nous allons parler
communities.
de
During this
l'importance
webinar,
de
we are going to
l'utilisation
talk
des
about
recherches
the
recherche
importance of using
pour
research
l'amélioration des
to
résultats de
improve
planification personnelle
family planning results in
Alors,
the Ouagadougou
dans
Partnership
l'étude
region.
qu'il s'agit d'abord d'elle,
So
ce mot latin
this
datum,
Latin word
sans
datum,
aller plus loin d'arrêt,
if we
signifie si
look more
quelqu'un donne à
closely at
quelqu'un
it,
ou
signifies
c'est
that
qui est donné à quelqu'un. Donc,
it
c'est
is
ici pour
something that
aujourd'hui
is given to
dire
someone.
que c'est un bien et un bien
So
précieux.
we should recognize that it
Que
is
les
a
personnes
precious
investissaient
good,
de
and
l'énergie,
people take
de leur
time and
disponibilité
energy in
pour nous en
order
procurer.
to get this
Aujourd'hui,
data
on
for
parle
us.
donc de nos grands chercheurs, de nos valeureux chercheurs,
And
pour
we
lesquels
have
je profonde
some wonderful researchers,
considération
and
et
I hold them
admiration.
in very high esteem. I
Ces
admire them very
chercheurs
much.
mettent à la disposition des
These
gens avec
researchers
lesquels les informations et les connaissances
are able
utiles
to provide
mises
data
à la
and
disposition des
information
politiques
that we
et
can use
décideurs
and that we can make available
en santé, notamment en santé de la
to
reproduction
decision
et de
makers,
l'éducation familiale,
and we can use them
et
in
nous avons compris
the
là
development of
que
plans and in
nous
family
avons
planning centers.
une chance extraordinaire aujourd'hui
We
d'avoir
are
dans notre
very lucky
panel
today
donc ceux qui
because in our
produisent
panel today
les données,
we
les
have
rechercheurs, ceux qui exécutent
researchers,
les gestionnaires
data
des
specialists,
programmes ou les
those who
politiques,
use
et
research and
également
data
ceux qui
in
au fond
developing
vont
policies,
utiliser
and those
ces
who
résultats de la recherche,
use
que ce soit en tant que
these
gestionnaire de programme ou
research
des gestionnaires de
results
plan de
in
santé,
order to better
et
manage
malheureusement,
programs or develop
il n'y a pas
policy.
une linéarité entre la production et l'utilisation des données
Between
ou entre les
the
besoins
production and the
de la
use
recherche et
of
de
data,
l'utilisation
we know that there
de
is
cette
need
donnée.
for research
D'où
and
l'intérêt
use for this data.
de ce webinaire, de cette session,
That's why this
qui
webinar is
permet de
so
regarder
interesting and so important,
les différents pans
so
de
that we
cette
can look
thématique
at the different
extrêmement
elements
importante
of
pour le
this
développement
topic, which is so
de la
important
santé
to the
dans le
development
monde en général et en
um,
particulier
of
dans
health
les pays
care
ruraux.
in different regions and
Dans le
particularly
domaine de la
in the
santé,
OP
il ne s'agit
countries.
pas seulement de
In the
l'information,
field of
de
health,
juste considérer que
not
les
only do we
résultats
need
scientifiques
information, but we should
de la
also
recherche,
take into
c'est
account
une
the
opportunité
results
pour les
of the
gestionnaires
research. And we should see
pour
that they are an
réussir
opportunity
la plupart des
for managers and for
pour le
leadership
bien-être
when they are
des
working on
communautés.
programs and when they are trying to improve the well being of communities.
Ici aussi,
And I would
c'est
repeat it here,
la
as
recherche et la
anywhere,
recherche,
that
c'est pas un
research
investissement, mais c'est une
is not
nécessité
an investment,
qui
it is a
sécurise les
necessity.
autres investissements.
It is a necessity that will
Mesdames et
secure
messieurs,
other
le programme de
investments.
webinaire
So, ladies and gentlemen,
d'aujourd'hui est
the
tout d'abord,
agenda for our webinar
nous avons
today is
un mélange
very interesting. We have a
de
mix
sucré salé,
of,
bref, toutes les
I would
saveurs sont là.
say, we have a
Nous
sweet
ferons
and
ensemble
savory mix of different
spécifiquement
perspectives.
sur l'agenda du partenaire Ouagadougou.
We are going to look at
Qui
the
sera
contributions to
donc un
the
élément
OP
de base, de
agenda.
réflexion, de partage
And we're
d'informations.
also going to
Nous
share
préparons
information.
la
We're going to
discussion avec
encourage
les experts
reflection.
panélistes.
We're going to speak
Un
with
exemple,
experts on our panel
l'utilisation des données de la
who
recherche
are going to talk about
pour ensuite
the
finir
use of data
par un
and the
résumé
use of
de la
research
place de la gestion de la
and
gestion des
its
connaissances
place
dans
in
tout
knowledge
engagement de
management
production et d'utilisation
within the
de la recherche
um,
ou des résultats
ecosystem of research and
pour
results
améliorer
and
les
decision
résultats
making.
de santé.
So, we're all going to
Et
talk about how
encore une
we can
fois,
use this research to
chacun,
improve
merci
our
pour votre
health results.
participation.
Thank you
Je
so
vous
much to all
remercie
of you
pour
for
votre
being here
disponibilité.
today,
Merci
and
pour le temps accordé
many thanks to our
cette
panelists
préparation
for
de cette
taking the
session
time to be
et
here
également
to
à
share
nos
your
chères
expertise during this session.
traductrices et
Thank
tous
you
ceux
as
qui ont
well
été
to our interpreters
dans la
who,
gestion technique de ce
and
webinaire.
thanks to all those who worked on the technical side of this webinar.
Alors, comme je le disais à l'entame
So,
donc
as I was saying,
de mes propos,
before I
nous allons
started
discuter
with some opening remarks, we're going to
la
talk
recherche
about
au Pérou.
the
Et j'ai
research agenda of the
le
OP.
plaisir
And I have the
d'introduire
pleasure of
Dr.
introducing
Abdoulaye
Dr. Abdoulaye Husseini.
qui est titulaire d'un
He
doctorat en anthropologie
has
social,
his
technologie.
PhD in social
Il dispose
ecology,
également des masters en
and he
sociologie
also has a master's in sociology
spécialisation
and
sur
a specialty
les savoirs
in
et les sociétés de l'Université de
in
Poitiers.
knowledge.
Ouseni est un spécialiste de l'analyse des politiques
Dr. Useni is a
de
specialist
santé publique
in
avec
policy,
14 ans
public health policy
d'expérience
analysis.
au
He
niveau
has
national et au niveau
many years of
international
experience at the national and regional
la
levels.
planification et
He has done
stabilité
some
du
in-depth
renseignement de
studies
l'évolution et
of
de
the
l'indisponibilité
development
des
of
systèmes de
policy
santé.
for
Donc,
public health programs for young people. So, without
voulez-vous bien
further
nous
ado, Dr.
nous
Useni,
définir c'est
I
quoi
leave the floor to you to talk to us a
votre
little bit
travail?
about the research agenda for the
Merci
OP. Thank
beaucoup,
you.
Dr. Sangare,
Thank you very
pour
much, Dr.
cette
Sangarej,
introduction
for this kind introduction.
bien préparée. Donc, en
And
tant
thank you
que
for setting the
responsable
stage
de la
for
recherche
us.
du partenariat de
So I'd like to
Ouagadougou,
talk about
aujourd'hui,
the
je m'en vais
OP research agenda.
parler un peu de ce que
I'm going to talk
développe
a bit
le
about
partenariat de
the
Ouagadougou et envie de
partnership's
faire en termes
efforts and
de
what
recherche et
the OP
d'utilisation
is trying
des
to do in terms
résultats
of research
de la
and the
recherche.
use of the results.
Voilà, donc pourquoi un agenda de recherche
So
dans le
why
partenariat de Ouagadougou? Donc
why
l'objectif
a
de
research
cela
agenda?
est
It's
parti
important to
d'un peu
recognize
de
that
quelques
this is
constats. D'abord, nous
part
avons
of several
le,
different
le
observations.
ralentissement des
So
progrès
we
dans
first
la
have
réalisation de services
sluggish
de
progress
planification
despite
familiale. Nous savons aussi
efforts.
que le gouvernement du
We
Cap-Vert
also know that
ont
the
fait beaucoup
collaboration
d'efforts
between
et qui ont permis
governments
une
and
performance
the
accélérée en
partnerships
nombre de femmes
has
additionnelles
allowed
utilisées
us
pour
to
les méthodes
accelerate some
modernes de
progress,
contraception, surtout entre
particularly with the
2012 et
uptake of
2020.
some contraceptive
Et
methods.
nous
That
avons
was part
aussi
of the
découvert des constats de
2020 plan.
l'insuffisance de production
But we
de
have
recherche sur
also
la
noted
planification familiale
insufficient
au niveau
research
de
on family
Ouagadougou,
planning for
qui
Francophone
sont
West Africa.
traduits par le besoin
And
d'une recherche
this means
ciblable
that we need
qui
more
pourra aider
local
les décideurs
research
à
in
définir
order to
les
help
objectifs
decision
de
makers
planification
to define
familiale,
policy
mais
about
aussi
family
à
planning,
évaluer leur
but
impact.
also so that they can
Et
evaluate the
parmi
impact of these
ces
policies.
constats aussi, il faut ajouter la
Among
faible
these other
utilisation des données
observations,
qui
we
existent
have
déjà
noted
pour
a low
informer les
usage
politiques et
of
les programmes
existing
dans la
data
région.
in order to
Pour
influence
cela, il est
policies and
que de
programs in the
nombreuses
region.
recherches ne sont pas diffusées ou ne
Most of
sont
this research
pas
is not
contrôlées ou elles sont
widely
laissées
shared.
dans un
It has
format
not
qui ne sont pas
been disseminated.
qui n'est pas accessible
And much of
facilement.
this research, much of this information is
Donc,
not
il
easily
faudrait aussi
accessible.
que les
So
recherches
it is
soient
important to note
financées
that
le plus
research
souvent ou
is
adaptées par des bailleurs ou des
often
organisations
uh,
non gouvernementales
requested
avec
by
non
donors
pas
or by
beaucoup de
organizations
concertation avec les décideurs
without
politiques
working with
sur
the decision
les besoins
makers
de recherche.
in terms of questioning
Slide,
what
please.
needs they have in with for research.
Donc, c'est dans ce cadre
So,
que le
in this framework,
a mis en
the
place
partnership has
un
set up
dispositif
a
un
mechanism
dispositif de renforcement
to
des,
reinforce
pour renforcer disons, la recherche utile à la prise de
research
décision.
that facilitates
Et ce
decision
dispositif
making. It is a mechanism
s'organise autour
which is
de quelques composantes.
organized around a number of
Et ces
components.
composantes
These
sont
components
la mise
are,
en place
first of all,
d'un conseil de recherche,
setting up a
un
research
conseil de
council
recherche qui regroupe
which
les différents
is made up
autour
of the different
la recherche.
stakeholders
Nous avons dans
in
ce conseil de
research.
recherche
This
jeunes,
research council
nous avons
includes
dans ce conseil de
youth,
recherche les bailleurs de fonds, nous avons
donors,
les gouvernements,
government representatives in this research council, and we also have specialists and experts in the research area. This research council aims at sharing and prioritizing resources, national resources, and also for donors to support family planning policies in countries and to reinforce research capacity building locally. The role of this council is to provide advice to the Ouagadougou partnership regarding the research agenda. Another component is the creation of a research network so that local research institutions in their own communities can work, and this would guarantee the production of results which are locally pertinent. This also aims at taking up the challenges of using the research data so that country decision makers can count on the data produced and be guided in the decisions they make. The other aspect is the creation of a catalyst fund. In Western Africa, French-speaking West Africa, we have a permanent challenge because opportunities and funds are limited in comparison with other regions in the world. So setting up a grant fund program within the Ouagadougou partnership will, we hope, engage change in national policies and funds. So a fund has been earmarked to do research on priority topics for the countries in the Ouagadougou partnership. Next slide, please. So the research topics to improve policies have set up an agenda in order to incentivize research to use research data. One of the actions was to identify certain priority topics for the countries in the Ouagadougou partnership. Identifying, determining these research issues is based on the local needs of each country. So this has also been one of the pillars of the research of the Ouagadougou partnership. These topics have been identified through an inclusive and participative process, which began with a workshop on research held in Conakry, which got together more than 70 participants So national managers of family planning organizations, representatives of the MOH, youth leaders, reporters, technical and financial partners, as well as donors who also took part in this workshop. The aim of the workshop was to talk in order to identify research challenges and to propose topics which would be a priority in the research field. We were able to identify a number of topics, more than 40, which we reworked on so that we could identify more broadly. We also asked for the input of the Scientific and Research Council. In this framework, we were thus able to identify 7 topics which we made a call for bids about through different research institutes belonging to the Ouagadougou partnership. We have to say that this process is ongoing. Research institutes have been selected on 3 priority areas. First, the youth access to FP, the discontinuity of access to family planning, and issues linked to making family planning free. In this network of our partnership, there's also discussions with other donors on other topics, which will probably get funded later. Next slide, please. We have to say that in this framework of action, research for action, in order to improve family planning policies, some processes have been rooted in this research. It's not just a matter of doing research, because we have a lot of research data. A lot of research has been conducted in the different countries of the partnership. The aim is to be able to use the data produced by research so that we can change things and create a framework which helps using this data for all the stakeholders. Also, through this research, the different research institutes and decision makers, as well as other stakeholders, including the civil society, will be engaged in developing roadmaps, committing themselves to using the research data, not just to have data, but to use and to identify data which will be able to influence decision-making and policies. So all of this will be documented, especially the changes that we will be making. All this will be documented and shared through meetings and conferences between the different stakeholders. And what we want to do is to make an impact in the long term using this new action research agenda, which has been developed in the Ouagadougou partnership. So this is the information I wanted to bring to your attention regarding the efforts of the Ouagadougou partnership regarding action research and the results of research. Next slide, please. Thank you so much for your attention. Thank you very much, Abdoulaye, for this presentation, which gives a good overview of the research agenda of the Ouagadougou partnership, which, as we understand from what you said, comes from a number of observations, such as at some point the partnership was making progress, the contraceptive prevalence rate began to slow down. And following this observation, we needed to know what was going wrong. Also, poor a lack of resources, of available resources for research, and lack of cooperation, research cooperation between researchers or between researchers and the users of research outcomes. We also took stock of the fact that we were using mostly 3 different mechanisms. So setting up the Catalyst Fund, as well as a mechanism to make sure that researchers were in a network so that they could share research. All this to work on a number of topics based on each country's needs. So I think this bodes well for the future and will be at the survey. And this is a good introduction for our webinar, in which I would like to introduce our panelists, including Mariam, who is a Senegalese woman with a passion for public health, particularly maternal and child health. She holds a BBA in business management, as well as a master's in public health. She has worked in a number of family health issues, and she's now the coordinator of a research project with the London School, which wants to examine ethical considerations in family planning programs in French-speaking West Africa. Previously, she gained a lot of professional experience in the field of sexual and reproductive health with NGOs in Senegal and particularly in research. Our second panelist, who is a researcher in our sub-region, and I don't think it's necessary to introduce him again, but I will. Seni Kunda, who is a medical epidemiologist, director of research and head of the public health department at the Health Science Research Institute, and also head of the sexual and reproductive health unit at the Health Science Research Institute, and he also has a doctorate in medicine from the University of Ouagadougou. He worked in a lot of areas: HIV, reproductive health, health systems, with a number of donors, USAID, the Gates Foundation, the Global Fund. And as I said, he is extremely experienced in research with more than 200 published articles in international journals. And he's also the co-editor of a book on evaluation methods and practices in Africa. As I was telling you, we are very lucky to have those very people who produce research, and those who use research. And so it is my pleasure to introduce Dr. Thierry Omolade Lawale, who is a public health physician specializing in sexual and reproductive health.
He has more than 20 years of experience in primary health care. Dr. Lawale has worked at all different levels of the health pyramid in Benin. He has been the head of the unit, a coordinating physician, the head of the maternal and child health service in the regional directorate before being promoted to the Ministry of Health as the head of the maternal and child health service. Since April 2023, he is the director of the Mother and Child Health and Nursing and Obstetric Care in the Ministry of Health. Ladies and gentlemen, dear panelists, thank you so much for being here with us for this discussion. So first, let's do a quick run-through of initial questions. I'd like to start with a question for Dr. Lawale. So let's say that we have generated some data. We have research results. There has been a great deal of research that has been done. Given your experience, you have worked at every level of the health pyramid up to today when you are the director of Mother and Child Health. For you, what is the importance of the results of the research with regards to implementation of health policy? Please go ahead. Thank you very much. Hello, everyone. Thank you for organizing this webinar. So first, I'd like to say that all policy, all health measures seek to resolve health-related problems. We work in schools, we work in universities. So we are looking at the root causes of the problem as well as the factors that influence it. So research takes on more and more importance because it is research that's going to enable us to describe the problem as a whole, and it is also a tool that researchers and healthcare policymakers can use. When we're looking at the research, we can analyze the causes, we can analyze the determining factors, we can better understand the causes, the consequences, and we can also start to better formulate appropriate approaches to resolve these issues. In the program design, research can play an important role. With regards to implementation, research needs to be there in order to support the work of implementation. And this is important in two different dimensions. First, in order to ensure that you are working towards your desired results. So research will help make sure you're on the right path. It is also important to use research to analyze the ecosystem, to understand the environment, to better implement programs. We need to have information and good information resources to make sure that we can best implement our health programs and projects. At the end, research is going to allow us to evaluate all of the work that we have done. It will provide us with data that we can use. So, from my point of view, research must go hand in hand with design, implementation, evaluation, every step of every project, every program in the healthcare field. With regards to reproductive health, it wouldn't say this is part of emergency healthcare where there's traumatic injury or things that need urgent care, but these are more insidious problems. These are problems that are often noted at a more personal, individual level. And perhaps there are effects on social norms or social values, or there are questions related to these issues. And so research will allow us to better understand sexual and reproductive health needs and results. We can also do research in order to look at social determinants. We can use research to look at this social and behavioral aspect. And this will allow us to better develop solutions to move forward. When we are starting a program, we need to start with research, and as we are approaching these solutions, we need to continue to use data. And the research and the results of this research is going to enable us to really support the people who are doing the work on the ground. And if you'll allow me to take a few more minutes, I would like to say that research should be available to assist us at any time, whether we're looking at the implementation of a project, of a program. We need to research the social determinants. We need to research the different determinants that can explain one thing or another, that can explain why something is happening. This is all essential when we get to the implementation phase as well. So research must remain an important influencer in decision making, implementation, and policy making. So, in my experience, we already have difficulty in accessing research and in accessing data and results. So, we need to make sure that the policies that we are developing and the programs that we are developing are based in reality and are based on data so that we can work towards real solutions. Often, we don't have all of the information we need, and that can cause problems. We need to make sure that we are putting the right emphasis on research and that we are spending the right amount of time looking at and analyzing different hypotheses, testing these hypotheses, and we need to make sure that we use this research to reach our desired results. Thank you so much. And that is why I would say data is essential. Thank you very much, Doctor. Thank you for all of these points with regards to the importance of using data, which we can say in general are so necessary to every step in the cycle of program management. We have research at the beginning, the middle, and the end, all throughout the process. So, yes, we need to do this work. We need to do these research so that we can provide the support throughout the program management cycle. So now I'd like to hand the floor to Professor Kuanda. Considering all of the importance that Dr. Lawalej gave to research, do you think today that our research institutes have the capacity to carry out the research that can help us make good decisions? So do you think that we have the capacity to provide this information? Thank you very much, moderator. This is a very important topic. I am currently on vacation, but it was so important to me to be here to participate that I am here to talk about this subject. It must be said, today, any researcher who is truly doing good research, who is ambitious, knows that his research is needs to be used and that his research will have an effect on health at the population level. It's not just because he wants to be published, it is to make sure that his results and his research can be used. We said for a long time that researchers were publishing in all of these peer-reviewed journals and that policymakers didn't have access to these journals. So they weren't using the research to influence their decisions. So we started to work with researchers who are trying to account for this. And indeed, we saw that there was work that was done in order to help researchers in writing up their research to improve communication with decision makers and with lay people. So most researchers have been trained now to write policy briefs and other documents of that nature. So their research can be translated into a simplified language or a less scientific language for policymakers. So today, we have that fact. Many researchers are able to draft policy briefs in order to draft documents that are comprehensible to policymakers. But we know that there is constant work to be done, so there are always new researchers coming up, and we have to train them as well. It's not, it's true that it is more gratifying for researchers to be published in the big journals, like in The Lancet, for example, but we help train them to understand that they need to make sure that their results and their research is understandable, that policymakers can understand the work that they have done. We work with different teams that are at all different levels, at the local level. There are not any large research teams, at least in the Francophone region. But, so that's the first element. So beyond the ability to draft policy briefs, we have not taught researchers how to go beyond the drafting of these policy briefs. How do they interact? How do they talk to policymakers? How do they talk to leaders? So we wanted to organize workshops in order to help researchers present their research and also to explain how do you bring this research, bring these results to the policymakers' agenda. And That is a huge gap in our skill set. Another element that is related to research is that it's not always gratifying. This kind of work is not what is recognized at the international level. So we need to make sure that teams are able to help researchers understand that this is a necessity. There are other factors that are related to the policymakers themselves. The policymakers don't always seek out the information. They wait for us to bring them information. There are questions of funding that is out there on the horizon, but they need results, they need data. And so they ask, do you not have this information? But the policymakers don't come out and seek out that data. They wait for us to bring it.
In Burkina Faso, there was an attempt to set up a management and knowledge transfer unit. However, it didn't go very far. It did publish the data regularly so that they could work with decision makers to see how these results could be communicated. But there are also factors linked to donors. When you do research for 3 years, once you've collected data, once you've drafted reports and conclusions, the project has ended and you haven't had enough time to do this. So sometimes the time you take to bring decision makers to accept the results of your research and integrate them into their agenda, this is a major challenge. So I was happy to see that in the Ouagadougou partnership, we wanted decision makers to make a commitment. That's what I meant to say. Researchers, more and more, have good training, but they lack some knowledge. And decision makers need to understand that if they really want to make an impact, they have to go towards researchers. We cannot accept a maternal mortality to not to decrease insufficiently. It's a catastrophe. It's a disaster. So we have to ask ourselves, when we draft an action plan, why is the decrease as it is? We have to find out. The researchers have to look for the reasons. So we need to talk to each other, decision makers and researchers. That's why I'm happy this webinar is taking place. Thank you. Thank you very much for raising these issues. There is capacity, but not as large as we see it in English-speaking countries. We have researchers, but there's some capacity which should be developed, and these capacities are not really there, whether they be capacities that have to do with the researchers themselves, their area of work, or there are also issues linked to decision makers as well as donors regarding the time researchers are given to do their work. You mentioned issues with collaboration or translation of the results of research for decision maker. Could you briefly tell us whether the type of funding that you receive take into account the translation of the results of the research in formats that decision makers or citizens can use? Please, quickly. Most donors, I'd say no, but we have been made aware of this. Even when the donor doesn't have it in their program, We find the time to do this work, but it's not enough. The process is not taken into account by donors.
Mettre à Dr.
For
Thierry là.
example, I want to give Thierry Lavallée the results we have on FP, and I want to provide him the results in an acceptable format. Maybe he's going to be very happy and will congratulate me, but there's an entire process to buy into the results and to adopt the results, and we don't have this process. We don't have time for it. Before I turn to Mariam Fall, Dr. Thierry, as the professor has just said, we do research, data is available, but we have problems so that you as decision makers can use this data. I'd like to know, at your level, can you identify issues with accessing the information that you need? Thank you. This is a very good question. The professor talked about how to present the results, in a format that is easier for us to look at, because you can have results. What researchers produce is an entire database which is available, and this should have an influence on the questions you ask yourselves, so that maybe the results might be, you might provide us with results that are more adapted to our objectives. We do not have traditional resources that are available. For example, in our area, we want to develop this area, but donors might not be ready to fund such research. So this will lead us to look into our experience, our life experience, our environment, and just use our common sense to set up targets which are not adapted to our needs. So I think that sometimes we do need funding in order to be able to fine-tune the analysis of the data in a way that is more tailored to our environment. The true factors that underlie the health issues that we're up against are there. So, second challenge that you talked about, the format should be digestible for the decision maker, because the format that is fit for publication in the Lancet is not fit for the general public or for decision maker or for general newspapers. Accessibility of information is still a challenge. I don't want to just keep talking, but there's also a challenge of collaboration amongst researchers and decision makers. And in the Benin Ministry of Health, we have a unit where researchers could deposit the results of their research. This unit is no longer in existence, but there is research being done. There is a plan to reactivate such a unit so that all researchers can contribute the results of their research. Last, in 1 minute, let me just add, our largest challenge is for researchers to produce the results to us in real time. There's an entire program we have 3 or 4 months. We sometimes receive, they have data which is not adapted to the context. Sometimes there's an ethical committee. So we have issues of timelines and agendas, which make it difficult to use the results of research. So we have to find a way. Thank you very much, Doctor, for these few words regarding the challenges regarding the use of research outcomes as a decision maker. And thank you, Professor, for your analysis regarding the challenges from your researcher viewpoint. But we notice overall that there is a lack of collaboration, whether it be regarding the needs, the strategic lines regarding the needs, so that there could be matchmaking between what the researchers are researching on, and in order to adapt to make the results actionable by decision makers so that they can build solid strategies. Thank you for your analysis of the situation. Now, I would like to ask Mariam Fall, in the framework of your activities, do you find a specific, when you carry out advocacy work, do you find difficulty in accessing the results of research? Thank you, Dr. Sangari, and thank you to my colleagues who have already talked. One of the major issues is access, indeed, access to data, especially in Francophone West Africa. As it has been said, there's a lot of data available in Anglophone databases. One young person will have trouble finding where the data is available so that they can do their advocacy work. So access is a real issue. You have a Google Scholar. It's really easy to access, but for finer data, it would be interesting to have today a reference where somewhere on the web where we could find data depending on the areas that we're interested in. Young people are interested, people who want to use the results of research to do certain work, whether it is advocacy or something else. But, we would need a reference repository somewhere for young people who do not necessarily know where to look to find this information. It is a major challenge, who to turn to find what we need. Then there's the challenge of how to use the data. It's nice to have results, but how do we use them? I thought it was really interesting for Professor Senikonda to say that they are training researchers to communicate the results of their research. It's true, researchers are happy to see their articles published in the Lancet or some other reviews, but not everybody has access to those journals. You have to pay if you want to find out the type of work that was carried out in order to get to those results. Some youth are looking for information, but they don't have the funds to do so. So youth do it through university at times or their institution, but sometimes they don't have the funds. So there is the issue of access, of use. And we also have the issue of the significance of research and how current it is, because we cannot go to the heart of the issue regarding reproduction without being able to take stock about where we're at a moment M. The data is not necessarily current. Where I was looking for information on meningitis in Senegal, and the data goes back to 2012. Nothing recent is available. So it's really an issue not to have data in real time. There's a problem here. We need to have current information. We have a problem with access, where to go and how to use as youth, young people who have a project and want to develop a project. Where do they go for their advocacy work to have their project accepted? So there's an issue with information, access, and also the significance of the research, how pertinent it is. Thank you, Mariam.
You talked about questions related to young people. How can young people collaborate with researchers, with more experienced or older researchers? From your point of view, how can this work? What are the challenges that face young people who are trying to get access to researchers or institutions where they can do more research? As I was saying, today we need to take an interest in people. If there is, for example, a list of researchers, of organizations, of institutions, of institutes that are approachable, that young people can go to ask a question or can seek out a mentor, then that would be wonderful. Today, say I go to the website of the Ouagadougou Partnership and I find a list that talks about an institution and the professors who work at this institution. I can go to them for advice. Even if they're not specialists in research or in advocacy, I can go to them to learn more about research. And they can explain to me, if you want to succeed, if you want a successful outcome of your research, here's what you need to do. You need to work and follow these steps. I think what's most important is to know who to go to and who to talk to. Thank you so much, Mariam. Thank you for this explanation. So it seems like we do have a significant problem of access to data, for example. And this is a problem, especially in Francophone West Africa. But we also have an issue of references. We don't know who to turn to. Young people don't know who to turn to when they want information, when they want to talk about data usage. Young people do not necessarily have the opportunities to come into contact with the right people at the right time in order to take advantage of their knowledge and their research. So thank you to our participants who have provided many different points of view on this theme, on some of the different subjects.
Mais un défi de rétention des chercheurs.
And thank you for talking about the difficulty of retaining and making sure that researchers stay in Francophone West Africa. So we'd like to talk a bit more about how these young researchers can find their place. We know that this is a challenge for the entire sub-region. So I'd like to give Dr. Abdoulaye just a minute or two so that he can talk to us a bit about capacity building in research institutes.
Merci beaucoup, Dr. Sangaré.
Thank you so much, Dr.
Voilà, donc
Sangaré.
rapidement, oui.
I'll respond
Vient de
very
parler
quickly.
de réseau.
Mariam has just talked about the importance of networks.
Il faut dire que l'ICPO est en train de faire
It's
une
important to
cartographie
note
des
that we are currently working on a map of research institutes, and we are focused on relevant topics. The interpreter has lost audio. It seems that we may have lost Abdoulaye. So while waiting for him to come back, I
Les instituts de
will.
recherche ont des capacités aussi faibles pour
Research institutes also don't have a strong capacity for. Please go ahead, Abdoulaye. Can you hear me? Yes, go ahead.
pour
So they
compétir
have a
avec d'autres instituts
very low
d'institutions
capacity,
de recherche qui sont
and these research institutes
ailleurs autres que le partenariat de Ouagadougou. Donc, nous, c'est de faire un renforcement
outside
de
of
capacité.
the Ouagadougou partnership don't necessarily have the necessary capacity to carry out all of the research they want. So it's a question of funding. They can work with different organizations. In working with USAID, we have also worked with EVIDAF in order to build the capacity at certain research institutes that work with the Ouagadougou partnership. We can work with some stronger, more prominent institutes so that we will have similar capacity to research institutes in other countries. I think that this capacity building aims to improve institutional capacity, but also we're looking at building the capacity of researchers who are working with implementation projects. This is a very specific field that will facilitate the design process and the development process for policymakers. This is a specific goal that these groups can work towards. So these are some very important research themes that can be included in this capacity building. Know that it involves a great deal of work to carry out this research and to share this research with policymakers. In an ideal world, we could work with local research institutes as well in order to build their capacity to identify specific local problems and the solutions to those problems. Thank you very much, Abdoulaye. Thank you for these words. Before we move on to Hadiza's presentation, I'd like to look at a question posed by Mr. Diallo, who talked about other challenges. Another challenge is collaboration with other fields like communication, knowledge management, etc., in order to make research results accessible and comprehensible to lay people. So researchers are not able to do all of this, even if they have been trained on knowledge transfer methods. So how do we, this is an important challenge that we have to tackle in order to improve the sharing and the use of data. So now I'd like to hand the floor over to Dr. Hadiza Kadri. She is a researcher in Niger, and she works at the Directorate General for Population and Reproductive Health in Niger. She also works for the Directorate General for Family Planning. She is the supervisor of the R4S project in Niger, and she has also worked with the technical working group for self-care. So she has a great deal of experience as a physician working in hospitals. She has done that for almost 10 years. Then she worked for UNFPA, and she also contributed to the development and the implementation of many different strategies in Niger, in particular the prevention plan for adolescents and the reproductive health plan, as well as the action plan for maternal and child health. Dr. Hadiza, you have the floor. Thank you very much, Dr. Sangare. As you said, we would like to take the opportunity to share our experience with regards to the type of research that we were able to do within the framework of the R4S project. We'd also like to talk about the importance of using these research results to improve family planning results. Next slide, please.
Voilà, donc quelle était l'approche que le projet R4S
So what was the R4S project, and what was the nature of its collaboration with the Directorate for Family Planning? As you can see here, we had a framework for using the results. This was developed by, we developed a research and learning agenda, and this represented the foundation of our work. In the recommendations included in this agenda, it was recommended to create a technical working group. So we needed to establish this group, and this group would take control of the research. Then there was the implementation of the research that was focused on these different topics. Once we completed the research, we worked on sharing the results, as well as the development of several products, several tools, and of course, we were also able to provide our technical assistance in working with this research. As I said before, there was the initial phase, which was developing the research and learning agenda, and we had a main goal to help the Ministry of Public Health. And we worked to identify the work that would allow us to achieve the goals that had been set forward by the costed National Action Plan. We also worked with the organization of a literature review, data analysis, interviews with key researchers, and consultations with stakeholders. We were able to identify 13 questions, which were the strategic axes of the Costed National Action Plan. I saw that in the panel earlier. Often we came back to this issue of a lack of collaboration between the government and research institutes. With the R4S project, we have worked to improve the collaboration, and we worked in close collaboration with the ministry and with researchers. Next slide.
Implementation phase of the research program, we created in August 2021, we created a technical working group regarding self-care and FP equity within the Directorate of Family Planning. Why? Because the ministry theorized all the issues that had to be researched on, and so they decided that linking those two topics with research, we were able to address our needs for family planning and other issues. So this was integrated into our strategy because the health cover in our country is about 50%, and we had to remedy this situation so that the population would be able to access PF services, FP services. So this was necessary, and this is why the DPF, the Family Planning Directorate, set up a work program and a technical working group. In order to get ahead with this, especially regarding the self-care policies, so to further the development of those policies and programs based on the country's needs, we led an exploratory analysis. This was done in two other countries, Nepal and Uganda. And the idea was to define behaviors and preferences of men and women regarding self-care for FP. And also service providers were at the center, at the core of this exploratory study. Also, in Niger, for example, we take into account the opinions of the traditional leaders who are very important in our community. So we wanted to know how they, because all this information was made available to decision makers who were able to use this data to develop or redirect new strategies for family planning. Next slide. Regarding equity, still to advance equity policies and programs, we set up a working group on equity at work. And so we tracked equity measures through the DHIS2 tool. So the indicators were defined. The Family Planning Directorate was able to extract the data, and we would analyze the data. So the results was the dissemination. The results were disseminated with the working group in order to guide research or community intervention projects and programs. So for the future, the upcoming studies, we are going to map FP implementation partners so that we know to try and better cover our country, and we're doing a mixed case study on equity now, implementing the knowledge. What will we use the results for? To develop or change innovative policies and strategies to achieve equity in FP programming. And also make these studies available to FP institutions so that they can capitalize on this, and also try and inform the public as much as possible, because we know this can lead to more action in favor of using FP, sorry. Also, we wrote a technical summary explaining all this. Last, the key messages are that we want the R4S project used a systematic approach. We didn't start from nowhere. We used the results of research elaborated by other groups, and then we worked in collaboration with the Ministry of Public Health, and then we developed and prioritized implementation issues. So then there was a prioritization of this research. There was a recommendation of the RLA to set up the working group, and also prioritizing the implementation of science issues will enable us to achieve the national family planning objectives. So Niger identified self-care and equity in FP. So this approach implemented in other countries will be relevant in different contexts. This is what I wanted to share with you. This was the experience I wanted to share with you, the R4S project in Niger with the Family Planning Directorate at the Ministry of Health in Niger. Thank you. Thank you very much for sharing your experience, which I think is extremely fruitful and shows how well thought out collaboration at all levels, whether it is at community level, at decision-making level, at government level. This shows how we can obtain better results in how to collaborate better and better use the results of research, going through generating data so that we can understand how communities perceive certain issues, how service providers perceive them as well. So this type of work obviously led to capitalize on the results that you obtained. There are a few questions in the dialogue box. If we cannot answer these questions right away, the panelists will be happy to answer them later. I would like to introduce Aissatou Choi. She is in charge of knowledge management in Francophone West Africa, and she's based here in Dakar. She's going to share with you how knowledge management can help in research and in sharing research. We didn't start right on time, so I would like us to continue if it is possible at all. Aissatou, thank you very much, Doctor. I'll have to go a little fast, and I'll start where my colleague just ended. We talked a lot about the use, and when we look at different aspects of knowledge, it always leads to knowledge management. Next slide, please. So I think that this is a good summary of why knowledge management is important for global health and hence for research, which is just as significant. Information and knowledge are incredible assets which are generated by research. So if we stakeholders have an opportunity to access the latest results of research, it can help us to make great strides. And also it informs decision making in the different organizations. Next slide, please. So the work for global health involves a diverse community of individuals and organizations. The groups that are most effective at achieving these goals have systems in place to regularly share critical knowledge, immediately access the latest research, and translate these lessons learned into better programs. So knowledge management, which is the process of collecting and keeping knowledge and connecting people with that knowledge so they can act effectively. This is at the heart of these systems. So knowledge management can improve coordination and enhance meaningful learning, collaboration, and application of the implementation of research results. Next slide, please. So this is the matrix of knowledge management tools and techniques which I'm sharing with you. This is what we do. And right now, I would like to concentrate on the outside of the circle and the elements shown in blue, which represent the different components of the knowledge management cycle, which help research and its use. First, the capture of knowledge. This involves documenting the information which facilitates access to knowledge, whether tacit or explicit. Why does this matter? How many times have we lost valuable knowledge and expertise when a member of staff just left? When we have research results, we need to be able to use them, but we also need to know how this information, how this helped make progress. So documenting everything we do is very significant all the way, whether it has to do with health and the analysis of knowledge. The idea is to eliminate data which is not significant and offering recommendations. We have to see the context in which we are working, what data we need, and to offer recommendations. There's also knowledge sharing. This is something that we do every day through disseminating and distributing printed documents. We talked about data sheets. I think this is also important to take into account when we do research. Then there's knowledge assessment. This knowledge has been used. How has it been used? So it's important to document the progress that were recorded in the use of the results of research. So we need to determine the right tracking indicators and so that the qualitative and quantitative data can be used. And then knowledge generation. Taking all this, we can create resources and generate new knowledge. Next slide, please.
So these are three cross-cutting concepts woven throughout the KM process. This includes collaboration, learning, and adaptation. We call this CLA. The work done by Dr. Hadiza and her team is something that we can easily see fitting into the framework of these three concepts. So this framework is promoted by the USAID Office of Policy Planning and Learning. It provides a flexible approach in order to enhance knowledge management and continuous learning for more effective implementation of the program cycle. Collaboration is intentional when stakeholders identify areas of common interest. They work together when it's logical. In doing this, they can avoid duplication of effort, and they can share knowledge across sectoral and institutional boundaries. We have learning, which takes place before, during, and after program implementation. Learning takes place when healthcare professionals develop, capture, analyze, share, and apply information and knowledge in order to improve programs. Programs need to take the time to pause, to reflect on new learning that takes place during program implementation. Then they must intentionally share this information with other partners, donors, and other implementing partners. And finally, effective adaptation occurs when partners apply learning and make corrections during the implementation in order to increase the impact of development assistance. So we use the results and the data in order to contribute to the collaboration, learning, and adaptation, and all of this involving the different stakeholders. So this slide is just to show you the importance of how we are moving towards change. So we have stories plus data plus visuals, which leads to change. It shows you just how important this can be to making research and data available and comprehensible. So we go beyond using scientific language and scientific data. We also use narratives in order to make sure that people understand the results of the research. And in that way, they will be able to use them since they have a better understanding of them. So you can present data using narratives, using visuals, using stories, and you can appeal to the emotional side of the brain by using this. So when people are more absorbed by the story, then we're tapping into many different parts of the brain that you can't access with just hard data. So we can provide data that comes from research, but we should also present it with the story, with the narrative, and with the visual, because that is going to facilitate access to this information for policymakers and for all stakeholders. Next slide. So here are a few examples of content format. There are many different formats and learning styles. Every individual has his own learning style and own preferences, and particularly when it comes to how they consume information. So the format or the medium you use to tell your story will depend on several factors: time, place, connectivity, context, and the audience's preference. So your messages and stories can take different formats depending on those factors. Next slide. These are some examples of data usage. So the White Ribbon Alliance Malawi has created a family planning dashboard on DHIS2 with all the necessary data, including stock levels of products, reporting rates, contraceptive use by method, and by age. Users have several ways to view the data, including at a national level, district level, and even at the facility level. So the data can be broken down by client age and contraceptive method. They also have developed an external dashboard, and they intend to include some sessions in order to share the experiences with Francophone countries who could benefit from these stories and from access to all of this data. Next slide. So this is also another example of the platform. And so now let's go to the last slide. So this is our platform, FP Insight. This is also a platform that provides access to different resources and to different information that is available online. Miriam talked earlier about a website where you could go to find information. So if you go onto FP Insight, you'll find lots of information. You'll find information about consultations. You'll find resources that have been developed by and for FPRH professionals. And by looking at what their needs are, you can also add resources to the platform. Any resources that you have access to, you can add to share with other professionals in the field. Next slide. So these are the characteristics of the FP Insight. It's available in 21 languages. It's got a personalized feed. There's a navigator button. You can see it when you're offline. And if you need additional information with regards to all of that, please contact me and I will respond and I'll be happy to respond and share information with you. Here is some information. If you want more, you can go to this website or reach out to me. Thank you so much. Thank you, Aissatou, for all of this information. And now we have a better idea of what we can do and how this knowledge management process works and how it can help all of us. We have seen all of this work, and this is not work that is just being done at the level of researchers. It is work that is done across the entire system. And this has given us an idea of how knowledge management works and how it can help us. So we are almost to the end of our time. So I'd like to take advantage of the opportunity to once again thank all of our panelists. They have given their time in order to prepare for this webinar and also to be here today in order to share their expertise with all of us. They have given their point of view on the different topics that we brought up, particularly with regards to the use of research results in order to improve family planning results in the OP countries. I understand there are still many challenges, but there are also some high points and some good experiences that we can take lessons from in our countries. So thank you very much. Thank you for giving us the opportunity to have this discussion. Thank you as well to our participants who took the time to be here and who agreed to stay a little bit longer than intended. And I'd like to say, I hope to see you next time at our next webinar. Thank you so much.